name's Katie. I'm going to be your student nurse today. I'm going to do a physical assessment on you. Can you tell me your name and date of birth?
Megan Ashby, 7594.
Do you have any allergies?
No.
Can you tell me where you are right now?
I'm at MCC.
Can you tell me what time it is?
It is 3 o'clock.
And who is the president?
Donald Trump.
My patient's alert oriented times 4. Speech is clear. I'm going to wash my hands. Are you having any urinary problems at this time?
No.
When's the last time you had a bowel movement?
Yesterday.
Alright, and are you in any pain right now?
No.
Alright. I'm going to take my patient's blood pressure. (110/68). I'm going to take my patient's radial pulse for 30 seconds. If it was abnormal, I would do a minute. The radial pulse is 2+ regular. Radial pulse is 68. I would test that bilaterally. I'm going to check her brachial pulse. It's 2+ and regular. I would test that bilaterally. I'm going to test her popliteal pulse. It's 2+ and regular. The posterior tibia is 2+ and regular. The dorsal pialis is 2+ and regular. I would test that bilaterally on both of them. I am going to look at my patient's head. It's symmetrical, appropriate for body size and midline. I'm going to put gloves on. I'm going to look at the scalp to see if there's infestation, any alopecia. And there's none present. I'm going to take my gloves off and wash my hands. The temporal artery is 2+ and regular. The temporal mandibular joint, can you open your mouth and close it? There's no clicking or crevices noted. Can you open your mouth again? The jaw movement is intact. Cranial number 5 is intact. The maxillary sinuses, are they tender?
No.
The frontal sinuses, are those tender?
No.
Alright. Now I'm going to go down to the nose. It is midline. There's no wounds or lesions noted. I'm going to look up the nose. Both nares are patent. The spectrum is not deviated. It's midline. There's no drainage noted. I'm going to put something under your nose. I need you to hold one side and smell for me and tell me what it is.
Alcohol.
Cranial number 1 is intact. I will test that bilaterally. I then am going to have you smile, frown, and raise your eyebrows. Cranial number 7 is intact. Then we are going down to the eyes. The eyes are 3+, round, and symmetrical. There's no edema noted, no redness. The eyelashes are intact. I'm going to look at the sclera. It is white and shiny. There's no drainage. The conjunctiva is pink with small vessels, no drainage noted. I'm going to have you follow my pen line, okay? 4 and 6 are intact. Now I'm gonna look at the ears. The ears are symmetrical bilaterally. And there's no wounds, there's no lesions noted. I'm gonna pull the ear back and look inside. The tympanic membrane is pearly white and shiny. There's no excess serum noted. I'm going to have you hold one ear, and I'm going to hold that ear, I'm going to whisper a word.
Nurse.
Cranial number 8 is intact. I will test the ear bilaterally. Now we're going down to the mouth. I'm going to wash my hands. I'm going to put gloves on since I'm going to be looking at the oral cavity. Open up for me. The hard and soft plate are intact. They are pink and moist. The uvula is present. Can you say ah? There's no redness noted. The tonsils are grade 0. There's no white lesions noted. The gums are pink and moist. Can you lift your tongue for me? There are small vessels present under the tongue. The tongue appears to be midline. It is moist. The teeth are present and in good repair. Can you stick your tongue out for me? Cranial number 12 is intact. We're going to go down to the neck. The neck is midline. The trachea is midline. There's no wounds or lesions noted on the neck. I'm going to check the carotid pulse on one side at a time. It is 2+ and regular. I will test that bilaterally. The skin appears to be warm, dry, intact. Skin turgor is less than 3 seconds. Capillary refill is less than 3 seconds. Now I'm going to palpate your lymph nodes. This is your preocular, postocular, occipital, jugular-gastric, submandibular, segmental, post-cervical, deep cervical chain, cervicoclavicular, and anterior cervical. Lymph nodes are non-palpable. I'm going to check the epilotrochlear node, and those are non-palpable as well. Alright, I'm going to have you stick your arms out. The arms are symmetrical. The joints are within normal limits. There's no deformities. Can you do your fine motor skills for me? Fine motor is intact. Can you follow me? Now raise your elbows and do your shoulders and up and down. Alright, full range of motion noted in the hands, elbow, arms, and shoulders. Alright, can you put your hands up for me and push against me? Now pull me. Alright, the same with your shoulders, show your shoulders. Alright, grade 5 in muscle tone is noted in the hands, wrists, and shoulders. Can you show your shoulders one more time? Cranial number 11 is intact. Now I'm going to go to your lung sounds. One, 2, 2, 3, 4, 4, 5, 5. I'm going to do the posterior lung sounds. If you would turn this way for me. 1, 2, 2, 3, 4, 4, 5, 5, 6, 7, 8, 9, 8, 9. clear to auscultation. There is no venous breath sounds noted. I'm gonna do heart sounds. That aortic is second intercostal space, right sternum border. The pulmonic is second intercostal space, left sternum border. The Erb's point is third intercostal space, left sternum border. The tricuspid is the fourth intercostal space, left sternum border. And the mitral is fifth intercostal space, mid-clavicular line. This is the apical pulse, and I'm going to take it for 1 minute. No murmurs noted at this time. Apical pulse is regular, 2 plus. Heart rate is 72. Can you swallow for me? Cranial nerves number 9 and 10 are intact. Respirations are 14. Can you lay down for me? The chest is symmetrical. There's no masses, no lumps, no wounds noted. Breathing is unlabored. Her belly appears to have no masses or hernias. I'm going to listen to her bowel sounds for 5 minutes in each quadrant. I'm going to start in the right lower. The right upper, the left upper, and left lower. I'm going to palpate in the same way. There's no masses present, no hernias. The umbilicus is in. Bowel sounds are present in all quadrants. Can you take your hips out for me? Take one leg out and one leg in. Alright, can you bend your knees up for me? Alright, and swirl your ankles in a circle for me. 4 range of motion noted in the ankles, knees, and hips. Can you push down for me and pull back? Alright, the same way with the knee. Push. Alright. There's 4 range of motion noted. The muscle tone noted in the ankles and knees is +5. Grade 5, excuse me. I would make sure I test that bilaterally on the muscle strength. I'm going to wash my hands and put gloves on. I'm going to inspect the feet, make sure there's no wounds, no lesions noted, and I will test that bilaterally. We'll wash my hands again. I'm going to make sure the feet are symmetrical. Look and see if there's any edema present. No edema noted. See if the hair is dispersed evenly, and it's good. I would also, during my assessment, like to readdress that I would have my patient do 4 range of motion of the neck, up and down, and do it in a circle. My patient has 4 range of motion of the neck. Push, and push against my hand. The muscle tone of the neck is a grade 5. I would also check and see if there's no jugular distension on both sides. I also look at the chest to make sure it's a 2-to-1 ratio. She has unlabored breathing. There's no masses and it's not tender to touch. And my physical assessment is complete.